Jessica with Better Speech. I am the Assistant Clinical Director, and I am here today with Kyle Ott, one of our wonderful speech therapists. So I will take question one. My 6-year-old can't say their R sound. When should we start working on it, or when should we consider speech therapy?
Yeah, so R is one of the trickier sounds. It is considered one of our later developing sounds. So with R, there's always a range too. So we're not every kid is going to develop that sound at the same time. Um, Typically, kids can start developing that R sound between 3 to 8 years old. So there is a big range with that sound. But um, if you're concerned about it, one thing that I would look at, or a speech language pathologist would look at, would be, are they stimulable for that sound? Are they saying that sound? Are they able to repeat that sound after you just by looking at you and hearing you say it? Are they saying it sometimes, but not all the time? Are they saying it with other consonant sounds? Can they say it at the beginning or the middle or the end? So there's a lot of different aspects that we look at when we're looking at how, if a child is having a difficulty with R. We also would look at, what what position they're saying it at. Can, like I was saying before, can you say in the beginning or the middle or the end, or with R blends or other sounds? Because R is R is there's lots of different aspects of R. Um,
Yeah.
and then we would also kind of look at, can they, how much direction do they need to make it? Can I train you, the parent or the adult working with the kid, to teach them how to say it just by a few cues if they're able to get it that way. But if you're really concerned about it, you can always have a speech language pathologist look at it, and we'll kind of we'll use your information that you give us and look at that in consideration to with developmental norms. But like I was saying before, every kid develops differently, so it's important just to keep that in mind. Is there anything else? I'm sorry.
I totally agree. I know for me, I get asked all the time, well, how many sessions will it take? And I kind of say the exact same thing you said. Let me look at the child, and then if they're stimulable, so like you said, if I can say it and then they can repeat it, or if I can maybe tell them to do something with their tongue and then it works and they can get it, then I tell the parent, well, maybe at a minimum a few sessions to coach you, to tell you kind of, here's the problem, here are some things you can try working on, this is what works for your kiddo. Or it could be a long time, it could be, just months and months. Sometimes these kids are with us for our therapy. So I tell them it's a huge range. And the best thing I think is to figure out, yes, are they stimulable at all? Can they produce it at all? Can they produce it with help? And if so, we have a lot more options. If not, I don't know about you, Kyle, but if not, I kind of let them know, it's going to be maybe a long haul. It's going to be a little bit time consuming, take some time and effort, and you may want to look at, moving forward with therapy. So yeah, I totally agree. I think that's some great insight. So the next question that we get all the time is in a little bit younger, but the question is, I can understand my 4-year-old, but other people can't. What's the problem? Is this a problem? So talk to us a little bit about that. What are the expectations for a 4-year-old?
Yeah. So one thing we want to look at too is just the understanding the difference between a familiar and unfamiliar listener. As a parent or a grown up who is spends a lot of time with the kid, you would be considered, that person would be considered a familiar listener. So, by 4 years old, you should be able to understand the majority, if not all, of what they say, as a familiar listener. Um, for an unfamiliar listener, so these are people, maybe you have friends that come over but they're not over all the time, they don't know the child very well, because as a familiar listener, you kind of develop a sense of, okay, this is what they're saying. You kind of know in your head, your brain kind of develops a way to fix kind of what they're saying,
Mhm.
and you understand them. But an unfamiliar listener who isn't around them all the time isn't going to understand them as much as you do. But typically, around 4 years old, unfamiliar listeners should be able to understand between 80 to 100% of what the child would say.
Hmm.
um, so that is one thing that you would want to look into. And if you were concerned about it, you could talk to a speech language pathologist. And what the speech pathologist would do is they would probably do you know a number of different things, between informal assessment, looking at just getting a speech sample, kind of seeing how much does the speech language pathologist understand them. And they would look at all the errors in like spontaneous speech, and then a speech pathologist would also use more of a formal assessment to compare them, to use normative samples to compare them to kids their age, the same age and same gender, and kind of see where they are at with those kids. And then the speech therapist, would look at that data, look at what your concerns are, what sounds are they having difficulty with. If they're having any difficulty with specific sounds, how simulable are they for those sounds that they're making errors in? Are they able to just listen to you and repeat yourself, like we were talking about earlier? Um, and then, we kind of go from there. We might say, hey, I recommend, doing some therapy, or hey, they're getting there. These sounds are they're developing these sounds, and that's okay too.
Hmm. Right. Okay. Yeah, that is great. Well, thank you so much for your wonderful insight and information. So it was wonderful talking with you today.
Thank you.
All right. Have a good one. Thanks, Kyle.
Thank you.